Today we're going to be taking a look at the cardiac axis as part of the cardiology series. As a starting point, we can define the cardiac axis as the net direction of the heart's electrical depolarization. This can be represented by the direction of the QRS complex on an ECG. The normal cardiac axis lies between -30 and +90 degrees, and you can see that anywhere in this green region here would be deemed a normal axis. Some patients may have what's known as a left axis deviation, where the angle of the axis is between -30 to -90 degrees instead. This can be seen in conditions such as left ventricular hypertrophy, where there's enlargement of the left ventricle and this shifts the axis towards the left. In the same way, some patients may have right axis deviation, which can be caused by pathologies such as right ventricular hypertrophy. Finally, in some rare cases, there might be extreme axis deviation, which can be seen in ventricular arrhythmias or in patients with dextrocardia. Overall, you can see how different types of cardiac axes exist, and it's important to be able to work out the axis to identify any pathologies which might be present. One way of calculating the axis is by having a look at the ECG Limb Leads, and just as a reminder, these are the leads which are on the arms and legs of the patient. If we plot these leads on our diagram, you can see how each lead represents a slightly different angle of the heart. We can therefore use some mathematical principles or vector projections to measure the heart's electrical activity from different directions, and this enables us to work out the axis. Just to explain this principle in more detail, if we have an impulse which is traveling towards an ECG lead, this is picked up as a positive deflection on our tracing. In the opposite situation, an impulse which is traveling away from an ECG lead, this is seen as a negative deflection. If we have an impulse which is traveling perpendicular to a lead, this is detected as equiphasic on our tracing, which means that we have both a positive deflection and an equal negative deflection. Finally, if we have an impulse which is traveling at an angle to a lead, this will be picked up as a positive deflection as it approaches the lead, followed by a negative deflection as it leaves it. Keeping these principles in mind, let's take a look at how we can calculate the cardiac axis by combining different leads together. With the Quadrant Method, the main leads that we want to take a look at are leads 1 and AVF. If we take a look at lead 1 first, this will essentially tell us if the axis is towards the left or the right. When the majority of the cardiac impulse moves towards lead 1, this will be picked up as a positive deflection in that lead, and it will tell us that the axis lies on the left side of the heart. Alternatively, if the majority of the cardiac impulse is moving away from lead 1, this will be picked up as a negative deflection, and it will tell us that the axis lies towards the right side of the heart. Using the same logic, we can take a look at lead AVF, which can tell us if an axis is upwards or downwards in direction. For example, when the overall cardiac impulse is moving towards lead AVF, this will be picked up as a positive deflection, telling us that the axis is downwards. Alternatively, if the impulse is traveling away from lead AVF, this will be picked up as a negative deflection, telling us that the axis is upwards instead. You can see how we can combine the information from lead 1 and AVF to isolate the cardiac axis to a particular quadrant using this method. To understand how this works, let's take a look at an example scenario where we have the following ECG traces. In this instance, you can see that lead 1 is positive, which means that the impulse is traveling towards lead 1 and thereby occupying the left-hand region of the heart. At the same time, we can also see that lead AVF is positive. This means that the impulse is traveling towards that lead and occupying the lower region of the axis. On the diagram, you can now see that we have this area of intersection where both of these hemispheres are combining. This suggests that the axis is inside this area of intersection, or between 0 to 90 degrees. Combining this information together, we can say that if we have a positive lead 1 and a positive lead AVF, it indicates a normal cardiac axis. We can remember this as a thumbs up appearance because both lead 1 and AVF have a positive deflection. Let's now take a look at a second scenario where we have the following ECG traces. In this case, we can see that lead 1 has an overall negative deflection, which suggests that the impulse is moving away from lead 1 and occupying the right-hand side of the heart. Simultaneously, we can see that AVF is positive, which suggests that the impulse is moving towards that lead and occupying the lower region of the heart. Just like before, you can see that we have this area of intersection between 90 to 180 degrees, which suggests that the cardiac axis is lying in this area. Putting this information together, we can say that if we have a negative lead 1 and a positive AVF, this is representative of a right axis deviation. And one way to remember this is by the phrase right is reaching, because you can see that both QRS complexes are trying to reach one another. Moving on to our third scenario, here again we have our tracings from lead 1 and lead AVF. In this case, you can see that lead 1 has a positive upwards deflection, which suggests that the impulse is mostly traveling towards this lead and occupying the left side of the heart. At the same time, lead AVF has a negative deflection, so the impulse is traveling away from that lead and occupying the upper region of the heart. Our zone of intersection therefore lies between 0 and minus 90 degrees. This scenario is a little bit different from the other cases because although we've narrowed down the axis to the upper left quadrant, we don't know whether the axis is between 0 to minus 30 degrees, which would be normal, or between minus 30 to minus 90 degrees, which would be a left axis deviation. To work this out, we have to get some more information, and this information can be obtained by adding another lead to our calculations. The lead that we usually add in this case is lead 2, and we place this at the 60-degree point on our diagram. The purpose of adding lead 2 is that it can divide our diagram into one more hemisphere. And to illustrate this, let's take a look at an example where lead 2 is positive, with the other leads remaining the same. Because lead 2 is positive, we know that the impulse is traveling towards that lead, and it therefore occupies this angled green region, which is highlighted here. Now we can see that the highest number of intersections occurs between the 0 to minus 30 degree position, demonstrating that this is a normal cardiac axis. Alternatively, if we have a situation where we have a negative lead 2, this would suggest that the impulse is moving away from lead 2 and occupying the orange territory, which is shown here. Notice that the greatest number of intersections is now between minus 30 and minus 90 degrees, thereby suggesting some form of left axis deviation. Summarizing all of this, we can say that if we have a positive lead 1, a negative lead AVF, and importantly a negative lead 2, this all indicates a left axis deviation. And this can be remembered by the phrase left is leaving, because the QRS complexes in lead 1 are going in the opposite direction to the other two leads. Let's now move on to our fourth and final scenario where we have a 12-lead ECG shown here. If you want to, you can pause the video and try to work out the cardiac axis in this case. Working through this, we can highlight our two main leads of interest, which are leads 1 and AVF, and we can zoom in to see the traces in more detail. Notice that lead 1 has a positive deflection, but it's majority negative, and in the same way, lead AVF is definitely majority negative. If we apply these findings on our cardiac axis diagram, we know that the impulse is moving away from lead 1 and therefore moving towards the right-hand side of the heart. Simultaneously, we know that the impulse is moving away from lead AVF and therefore towards the upper poles of the heart. Combining the information from these leads together, we have this point of intersection between minus 90 and 180 degrees, which suggests that the cardiac axis is lying in this area. To complete this, we can say that if we have a negative lead 1 and a negative lead AVF, it's indicative of an extreme axis deviation. And the way to remember this one is by remembering the thumbs down sign. So both QRS complexes in this case are pointing downwards. To finish off, we have a summary slide here which outlines the different types of cardiac axes, as well as the ECG findings for each type. I hope you found this video helpful, and I'll see you in the next one.